I think we have done ourselves a disservice in the training and education we provided in VL over the years, and this is demonstrated in the lack of confidence in VL devices. And where I see this a lot is that I review many of the video recordings which are made of our video laryngoscopic intubations, and these are being performed by my consultant level colleagues, by our trainees, by people with a high degree of anesthesia skill and very independent practitioners. And often, despite the fact that we've had VL as an accessible device in our facility for 10 to 15 years, despite the fact that we have an active training program, I see very poor quality video laryngoscopy. And I think this speaks to the culture that still exists in a lot of medicine of the sort of see one, do one, teach one. That we've taken people who we know are able to intubate with direct laryngoscopy, we've given them these incredibly capable devices, and we haven't trained them in the additional capabilities of the devices and how they can really use the devices to the very best effect. So I think guidelines are very useful in promoting how we practice. It's very difficult to create prescriptive guidelines because people's practice settings all differ, and we don't want to take away too much clinician autonomy in making decisions about what's right for individual patients. In fact, we're moving more and more in medicine to including the patients in the decision making. I think the moment we start using guidelines as strict prescriptive rules, we are actually doing ourselves a disservice because we can't imagine every clinical scenario that they could be used. Suggesting the routine use of video laryngoscopy for reasons of improved quality of intubation, improved patient safety, I think that's a very useful suggestion we can make, and I think the evidence is slowly and steadily supporting that opinion, that routine use of VL is sensible where the devices are available and where it's feasible to use it. The other factor is that we should not be reaching for a device with which we are unfamiliar when it comes to an emergency situation. We shouldn't regard it as only a rescue device because we'll never get sufficient expertise. We'll never flatten out that learning curve at a mastery level if we're not using the device on a regular basis. And the way that we get there, acknowledging that most intubations are in fact easy, is using the device routinely for all our easy intubations so that we are superlatively skilled with it when it comes to a difficult intubation where the device really makes a difference for that specific patient.